Um, Today we are going to look into learning outcome 2 of the Ascentis nursing program, and our major discussion will be to understand the roles of health and social care practitioners. Okay, and I'm going to be your lecturer for today, Daniel Commuter. Okay, all right. We need to identify some of the practitioners within the healthcare industry. So, who is a healthcare practitioner? These are professionals who work within the healthcare industry that provide medical care to patients. They are trained to diagnose, treat, and prevent illness and injuries, as well as provide ongoing care and support for their patients. Okay. In general, healthcare practitioners play a crucial role in promoting and maintaining the health and well-being of individuals, families, and their communities. Okay. We don't have to understand the roles of health and social care practitioners. An health and social care practitioner delivers health support from initial care to rehabilitation through building a close relationship with medical practitioners. They are able to support patients and their families to ensure their holistic care needs are met. These practitioners work in various settings, including hospitals, clinics, nursing homes, community health centers, social care agencies. These are some of the roles of health and social care practitioners. So we have, they diagnose and treat. They also prevent care. They do care coordination, and they advocate. Okay, these are four areas or responsibilities of social health and social care practitioners. So they diagnose, they prevent, they coordinate, and advocate. Practitioners advocate for their patients' rights and needs, including access to healthcare services, social services, and community resources. Okay. So the support they give. Practitioners provide emotional support to patients and their families, especially during times of illness, injury, or disability. They also provide counseling and guidance on coping with chronic conditions or life changes. Okay. Yes. So health and social care practitioners, they help emotionally with what they do. They help emotionally against persons with those who need those supports. They help. Support workers help. Nurses help as well. They support. They ensure that they are able to help you understand your situation and support you the best that they can. They also keep record keepings. They maintain accurate records of patient health information, treatment plans, progress reports. This information is used to inform future care and treatment and plans. Okay, record keeping is a key role for healthcare practitioners. So overall, health and social care practitioners play a critical role in promoting the health and well-being of individuals and communities, and their work is essential to maintain a healthy society. Okay. Um, there's a video link that I'll share that you can watch later. Let me copy it.
The role of a general practice nurse is varied. It's one of the most exciting jobs that you can have, I feel, in nursing, because you have everything from birth to death. You don't know what's going to be coming through the door. You can come into general practice and be what we call a general practice nurse. And that's what we call a treatment room nurse. And that's anything from doing blood pressures, ear syringing, dressings, leg ulcers or other dressings, doing smears, doing immunisations, doing a lot of what I call public health work as well.
No 2 days are ever the same, which is one of the interesting things and challenging things about.
And so let's look into how we can explain the roles and responsibilities of at least two named health and social care professions. So registered nurse, RN. Registered nurses are essential professionals in health and social care sector. They play a crucial role in promoting, maintaining, restoring health, as well as preventing illness. The main roles and responsibilities of registered nurses include an assessment, planning and implementation of care, patient education, advocacy, documentation. Okay, this is what nurses do. They always do assessment. They have to assess the patient. They have to plan and implement. They have to do patient education where nurses teach patients and their families about various aspects of health condition. They have to advocate. Nurses act as patient advocates, ensuring that they receive the necessary care and resources. And those advocates may eventually be reported to doctors so they understand what the patients are going through and all the confidential information passed on to nurses. Okay. Then we have to look at documentation. They have to do all the referrals, all the documentations, maintaining accurate, up-to-date patients' records, ensuring that all relevant information is available. Okay, this is what RGNs do. Then we have to look at occupational therapy, what we call the OTs. So the OTs, they are specialized healthcare professionals who focuses on helping individuals with disability, injuries, illness, to regain or maintain their ability to perform daily activities and participate in meaningful occupations. The primary roles and responsibilities of occupational therapists include A. Evaluation. OTs assess clients' physical, cognitive, and emotional abilities, as well as environmental factors that may affect their ability to engage in everyday activities. B. Intervention planning. Based on the evaluation, OTs develop customized intervention plans that aim to improve client skills and abilities. They also do what we call therapy implementation, where OTs work with clients to execute the intervention plans, which may involve physical exercise, cognitive activities, or use of adaptive equipment. Okay. Then we have client education. They also help to educate the clients as well in the performance of their duties. Okay. They do collaboration. They collaborate with doctors, nurses to ensure that the patient's recovery is met. Okay. And we have documentation. Like other healthcare professionals, occupational therapists are responsible for maintaining accurate and up-to-date records. That is key across board. Okay. Social workers. They are responsible for providing social and emotional and practical support to individuals, families, and the communities. They work with individuals who are experiencing difficulty life situations such as illness, poverty, employment, and abuse. Social workers assess clients' needs and develop plans to help them access resources such as housing, healthcare, and financial assistance. They also provide counseling and advocacy services to help clients cope with their situations and navigate complex systems such as healthcare and legal systems. Social workers may work in a variety of settings, including hospitals, schools, community centers, and government agencies. Some of the responsibilities of social worker may include assessing clients' needs, providing counseling and support, advocating for clients, collaborating with healthcare professionals, developing and implementing treatment plans, providing education and resources. Okay, these are things social workers. They advocate, they collaborate, they develop and provide education and resources as well. Okay, let's look at GP, general practitioners. In the UK, when we say GPs, then we're talking about doctors that diagnose and treat medical conditions in patients. They will specialize in a particular area of medicine, such as cardiology, neurology, or pediatrics. Some of the responsibilities of a physician include conducting physical exams and medical histories. Physicians assess patients' health status by conducting physical exams and reviewing their medical histories. Diagnosing and treating medical conditions. Physicians diagnose and treat various medical conditions using a variety of clinical interventions, such as medication, surgeries, and doctor procedures. Prescribing medications. Physicians prescribe medications to treat medical conditions and manage the systems. Collaborating with healthcare professionals. They work closely with other healthcare, such as nurses and all that, to ensure that the patient's health and recovery is important and key. Okay. Then we have educating patients. Physicians educate patients about their medical conditions, treatment options, and ways to promote good health. Okay. Ways to promote good health. Then let's look at, there's no question, let's look at pharmacists. Pharmacists are healthcare professionals who specialize in medication management. They work in various settings, including pharmacies, hospitals, and clinics. Some of the responsibilities of pharmacists may include dispensing medications. Pharmacists dispense medications and provide information about proper dosages and usage instruction. Conducting medical reviews. Pharmacists reviews patients' medical needs and identify personal directions or problems. Okay. Then let's look at educating patients. Pharmacists educate patients about their medications, potential side effects, and ways to manage their health condition. Very true and very important. Do they also collaborate? Yes. Collaborate with child, collaborate with all kinds of people. And then let's look at managing medication inventory. Pharmacists manage the inventory of medications and ensure that medications are stored and dispensed safely. Physician therapist. Physician therapists are healthcare professionals who specialize in rehabilitation and physical function. They work with patients who have musculoskeletal or neurological conditions that affect their ability to move and function. Okay, to move and function. Some of the responsibilities of physical therapists. Okay. Some of the responsibilities of physical therapists may include assessing patients' physical abilities, developing and implementing treatment plans, educating patients, collaborating, monitoring patient progress, and promoting patient independence. Okay. Okay. Promoting patient independence. Physical therapies work promotes patient independence and help patients develop skills to manage their conditions and improve their daily life. And we have another homework. Visit the website. There are 350 different AHS careers. Everyone makes a difference every day. List and understand 2 practitioners roles of choice. Social worker, GP. Okay. Then we have identify the key features of effective partnership working. Effective partnership working is characterized by several key features, including shared goals and values, and then clear roles and responsibilities. Shared goals and values and clear roles and responsibilities. Where shared rules and values is effective partnership working towards all partners to have a common goal or set of goals. Then we have goals and responsibilities. Each partner in a partnership should have clear goals and responsibilities that they are defined and understood by all parties. This helps to ensure everyone knows what they are doing, what they are responsible for, and can work together as well. So we have the clear roles and responsibilities. Can you hear me? Clear roles and responsibilities. See if you can hear me. Each partner in partnership should have clear roles and responsibilities that are defined and understood by all parties. This helps to ensure that everyone knows what they are responsible for and can work effectively. Then we have effective communication, very important. Communication is key, effective partnership working. Partners need to communicate openly and honestly and be willing to share information, ideas, and feedback. Effective communication helps to build trust and mutual respect among partners. Then we have trust and respect. Partners must have a high level of trust and respect for other. This means being responsible, transparent, and honest in all dealings with each other. Joint decision making. Effective partnership working requires joint decision making, with all the partners having a say in important decisions. It needs to help ensure that everyone's views are considered, that decisions are made in the best interest of all parties. And have flexibility. Effective partnership working requires flexibility and adaptability. Then we have commitment and investments. Commitment and investments. And number 3, flexibility. That's flexibility, commitment, and investment. Effective partnership working requires a long-term commitment from all partners and investment of time. Okay. Then we have partnership working, teamwork, multidisciplinary working are all related concepts that involve collaboration. And our partnership working is a broader concept that refers to collaboration between effective organization agencies, senators, such as healthcare, health social care, to improve outcomes for individuals. Then we have teamwork. 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 Teamwork, on the other hand, involves collaboration among individuals with the same organization or department to adhere to a specific objective. Teams may be composed of individuals with different skills and experience, and effective teamwork requires their and responsibilities. Effective communication and share accountability for the collection for the achieving of the team's goal. Achieving the team's goal, very important. Then we have the multidisciplinary working involves collaboration among professionals with different disciplines, such as physicians, nurses, workers, to promote comprehensive coordinated care to patients. Then we have effective partnership. Working requires several important components, including communication, then to identify and reducing barriers, 3, understanding boundaries for contracting, and then 5, roles and responsibilities. Where communication is effective communication, where identifying, reducing barriers to effective partnership working can include difference in organization culture. Then we have understanding boundaries. First, partners should have a clear understanding of their roles and responsibilities within the partnership, as well as the boundaries of their own organizations or sectors. This helps ensure that everyone is working together effectively. Contracting. Partners should have a formal agreement in place that outlines the terms of partnership, including goals and responsibilities. And exceptional. Then we have rules and responsibilities. Partners should have clear rules and responsibilities that are identified and understood by all parties. This helps to ensure that everyone knows what they are up to. Okay. So this is a table outlining relationship between health and social care. While social care is more important and more setting, Amen. That's the template. Healthcare, what they major in, social care, what they major in. You can see clearly 2 types of things. Okay. So healthcare focus on diagnosing ailments, while social care focus on the individual. Funding usually comes from health every year. Government programs. Funding usually comes from local authorities or from government programs. Okay. So we have what we call differences. Healthcare provides medical interventions. Social care provides social interventions. Okay. Healthcare is led by physicians and healthcare. Social care is led by social workers, care workers, and other social professionals. Okay. Then we see care workers in the example. And we have examples include hospitals, clinics, and physician offices. Example of social care involves include nursing homes, home care agencies, and community centers. Healthcare funding always comes from health insurance or government programs. Funding usually comes from local authorities or government programs such as social security or housing benefits. Okay. So overall, effective partnership working requires high level of communication, collaboration, and coordinated among partners. By working together effectively, health and social care professionals can provide more comprehensive, coordinated care to individuals and families, improving outcomes and promoting overall well-being. Okay. If you go down there, there are references that you have to read. Read the references. Make sure you have the Harvard type of references. Okay. And you go to your model, you can get most of the lectures right there, and you can have links to go through and understand better. Should you have any media support, please do not hesitate to contact me via WhatsApp or the office. I'll get back to you. Thank you. So your assignment font size should be 12. After you have a start of references, and make sure that you do that. Any questions, they do not hesitate to contact us. Okay. Thank you so much.